Welcome to TLDR Neuropsychology, where we discuss various topics related to the practice of clinical neuropsychology. Today we're continuing our series related to preparation for board examination. Today's topic is ethics in clinical neuropsychology. So we're going to cover an ethical decision-making process, the APA Code of Ethics, common sources of ethical conflicts in clinical practice, as well as the emerging field of neuroethics. The first topic is the ethical decision-making process. To be a competent practitioner of neuropsychology, it's important to understand and apply high ethical standards to every case that we see and every professional duty that we perform. Ethical competence guides our clinical decision-making, and it's useful for both normal practice as well as when we're faced with ethical dilemmas. And an ethical dilemma is a complex and unique issue that's not specifically addressed by professional ethical codes or guidelines. And these dilemmas often involve conflicts between multiple parties with differing ethical or professional duties. Another common dilemma is when two or more ethical principles or standards are at odds with each other. A practitioner's personal morals and values can also conflict with ethical guidelines. And finally, sometimes legal requirements are at odds with ethical standards as well. And all of those can lead to these ethical dilemmas. Making effective ethical decisions is best when there's a systematic process to come to our ethical conclusions utilizing multiple sources of information. An important concept to understand is that enforceable ethical standards are just the minimal level of acceptable ethical behavior. In general, they just allow practitioners to avoid misconduct, but we can go well beyond the level of ethics that's minimally required. Positive ethics embodies this idea that we can strive for the highest ideals and standards in our ethical practices. And this allows us to understand underlying moral principles as well as integrate personal and professional values and ideals. And it's best to be proactive in developing our ethical practices throughout our careers. That said, it can be important to be able to react effectively to challenges and dilemmas as they come up. So there's 4 A's of ethical practice. The first is anticipating. So you prepare for ethical issues and challenges that are common in your practice. Avoiding situations where ethical misconduct may occur. Addressing ethical challenges as they're anticipated or encountered. And finally, aspiring to the highest ethical standards of practice. So there's a variety of systematic ethical decision-making models to help us achieve this positive ethics approach. And these different models have different steps, but they often have overlapping features. So the one model that I'm going to focus on is called the core opt model. So you want to clarify what the ethical issue is and distinguish it from clinical, legal, and other professional issues. O is for obligations, where you identify obligations owed to relevant stakeholders. A stakeholder being anyone that reasonably could be involved in the process. R is for resources, where you identify, review, and/or consult ethical, legal, and professional resources. E is for examine, where you examine personal beliefs and values and their impact on your decision-making process. O is for options, where you consider possible options. It's important to think about some of the solutions and the consequences of those solutions. P is put into action, so you want to put into practice the best solutions that you've come up with. And T is to take stock, where you evaluate the outcome and then revise your ethical decision-making process as needed. There are a variety of sources that provide professional ethical related information. So the first source is ethics codes for the profession. And I've just listed the name of the ethics code for the American Psychological Association. There's also codes of conduct associated with state and provincial psychology boards. So there's state guidelines as far as ethical behaviors go. There's jurisdictional laws. Those can be state, federal, or even municipal laws. Publications and position papers from various professional organizations. So for example, the American Academy of Neuropsychology and National Academy of Neuropsychology often produce position papers about certain ethical challenges specific to neuropsychological practice. And it's important to be familiar with these position papers and how they apply to daily clinical practice for the written and oral components of the board certification process. Scholarly works can also provide insight into professional ethical practice. There's ethics committees. You can also ask your professional liability insurance carrier for guidelines about how to ethically handle certain situations as they come up. Whatever institution you're working in is likely to have guidelines as well as resources. Additionally, there's a variety of continuing education workshops and other presentations that discuss ethical practice, as well as you can consult with your colleagues to help hone your ethical decision-making process. So we're going to briefly discuss the APA's ethics code. I'm not going to go too deep into it, but you can look it up online. There's a free PDF as well as web-hosted versions that can be found. The APA ethics code consists of general principles as well as ethical standards. A general principle is more of an aspirational ideal for how you should engage in clinical practice, and an ethical standard is once again that minimal threshold for how to engage in clinical practice. So these general principles and ethical standards only apply to psychologists' activities that are part of their scientific, educational, or professional roles as psychologists. So here's a variety of different roles that a psychologist may perform as part of their clinical duties. And you can see that there's a broad variety of contexts in which it's important to follow these ethical guidelines. If the ethics code is violated, that may lead to disciplinary action by the professional body, usually at the state licensure level, but also within the broader organization of APA. That said, breaking the ethics code is not necessarily a criminal offense, though there are some laws that, if broken, will also violate the ethics code. And one important thing that's mentioned in the APA's ethics code is that it's not intended to be a basis for civil liability when it comes to lawsuits against you or your practice. The general principles of the APA's ethics codes includes beneficence and non-maleficence, and that's essentially you want to maximize the benefit and minimize harm to the people that you're working with. Fidelity and responsibility, where you serve the best interests of those with whom you work. Integrity, where you promote accuracy, honesty, and truthfulness. Justice, where you avoid injustice, limit the effects of your personal bias, and exercise reasonable judgment. And respect for people's rights and dignity. So you want to respect the dignity, worth, and individual rights of all people. As far as the ethical standards go, it covers 10 different domains. So the first ethical standards are about resolving ethical issues. The second relate to competence. The third is human relations. The fourth is privacy and confidentiality. The fifth is advertising and other public statements. The sixth is record keeping and fees. The seventh is related to education and training. The eighth is related to research and publication. The ninth is related to assessment practices. And the 10th is related to therapy practices. And you can look up the specific details related to each of these domains, but we'll highlight a few of the more salient ones when it comes to clinical neuropsychological practice and the ethical dilemmas that occur within that type of practice. This section is about common sources of ethical conflicts. So this is a great book to help improve ethical decision-making. And in it, Bush identified 12 ethical issues that are the most common sources of ethical or professional contention for neuropsychologists. The second being roles and relationships, particularly having dual or multiple relationships with a specific client or their support system. The third is related to test security and the release of raw data. The fourth is about third-party observers. The fifth is confidentiality. The sixth is related to assessment, whether it's methods and norms. The seventh is conflict between ethics and law. The eighth is false or deceptive statements. The ninth is about objectivity. The 10th is cooperation with other professionals. The 11th relates to third-party requests for services as well as informed consent. And the 12th is related to record keeping and fees. We're going to briefly discuss these 12 conflicts. However, it's important to note that you're going to have to come to ethical conclusions on your own. This presentation isn't going to provide specific instructions about how to resolve these conflicts. So the first is professional competence. So ethical practice requires proper training and competence and the ability to appropriately apply knowledge and skills. Neuropsychology, being a very specialized practice within the field of clinical psychology, requires extra training to develop this competence. It's indicated in the ethical standards that incompetence is unethical practice. So you don't want to be practicing outside of your knowledge base and skill set. And you can see the specific wording of the instruction down below. Board certification provides the clearest evidence of competency for practice in clinical neuropsychology, because your competence in the practice of clinical neuropsychology has been directly assessed. Continuing with professional competence, it's important to recognize that just because you're board certified in clinical neuropsychology, it doesn't automatically imply that you're competent in other subspecialties, whether that be pediatric neuropsychology, geriatric neuropsychology, rehabilitation neuropsychology, or forensic neuropsychology. They each have their own specialized knowledge and training that's important to develop before you engage in those practices. So another important principle related to competence is that it must be achieved in new areas of practice and maintained over time. As a professional, you have to continue to keep up with new research and information so that you can maintain competent practice and provide the best service possible. And once again, maintaining competence is one of these ethical standards. The next source of conflict is related to roles and relationships. So many contexts of neuropsychological practice involve interacting with persons other than the patient or examinee when providing services. So often, when engaging in neuropsychological practice, a collateral source of information will be involved as part of the evaluation, and that can help clarify some of the difficulties and challenges that the patient may be facing. So ethical conflicts when it comes to roles and relationships often arise secondary to having multiple professional roles with the same person or someone that's closely associated with the person. And this is particularly when there's risk of harm or exploitation. An example would be if you're already engaged with therapy with a patient, it's often inappropriate for you to conduct psychological or neuropsychological testing on that same patient. Your role as a therapist often involves being an advocate for the person, which can bias your examination of the data when you switch roles to evaluate the patient in a neuropsychological context. And once again, APA has ethical standards about having multiple relationships, and you can read through the specific standard listed below. And as I mentioned before, having multiple relationships can impact clinical objectivity and can adversely impact the patient's overall treatment and well-being. In clinical practice, having multiple relationships is a common ethical dilemma in medical, legal, or forensic practices, where often the provider serves in both a treating and forensic role. Ethically, everyone is best served when foreseeable roles, relationship expectations, and limitations to service are established and clearly outlined and agreed upon at the beginning of the professional relationship. And if there is a conflict of interest for the professional, that they withdraw their services. So as outlined by the APA ethics standards, you want to refrain from taking on a professional role when there could be a reasonable expectation that it will impair your objectivity, competence, or effectiveness, or it will expose the person or organization to harm or exploitation. The next common area of ethical conflict is related to third-party requests for services and informed consent. Frequently, neuropsychological evaluations are requested by third parties. So that can be healthcare professionals, family members, attorneys, school officials, government service providers, or others. The ethical guidelines include clarifying with all parties regarding the relationship that you as a professional will have with each party, the nature and objectives of the service, the role that you're playing as a neuropsychologist, who is the client that you're working for, how the information will be used, who should have access to the information, and the limits to confidentiality. So the standard for informed consent requires using language reasonably understood to the person or parties, and if someone is incapable of giving informed consent, then the psychologist should provide an appropriate explanation, such as describing the process that will occur, seek the individual's assent. So for example, this is common with evaluations involving children, where it's important that the child agrees to go through the evaluation. Third is to consider the person's preferences and best interests. And fourth is to obtain appropriate permission from a legally authorized person. Typically with children, that can be parents, or with someone that's deemed legally incapable, that will be their caregiver. And even if you have this consent, you're working to take reasonable steps to protect that individual's rights and welfare. As part of this process, it's important to provide probable consequences to the individuals and parties about what will happen if they choose not to participate in the services. The next source of ethical conflict is test security, or the release of raw test data. So loss of test security can threaten the usefulness and validity of clinical instruments and tests. So this can cause tests to become invalid and lead to harmful outcomes due to inappropriate or inaccurate conclusions and diagnoses following evaluation. There is an APA guideline related to maintaining test security, wherein psychologists are responsible to maintain test security of materials and other assessment techniques consistent with the law, and that can include copyright law when it comes to specific copyrighted test materials, as well as contractual obligations. So there is some conflict within the APA Ethics Code regarding release of test data and test security. Patients have a right to have test data released to them, and that includes raw and scaled scores according to the APA guidelines, as well as their responses to test questions or stimuli. So as highlighted, psychologists are required to provide test data to the patient or other persons identified by a release of information. Psychologists may refrain from releasing test data to protect a client or patient or others from substantial harm or misuse or misrepresentation of test data, recognizing that in many instances, release of confidential information under these circumstances is regulated by law. Regarding this conflict between test security and test data, for many neuropsych measures, it's impossible to separate test materials and data from the protocols, which are protected under copyright, as well as the stimuli, which are not to be released. For example, a patient's responses when learning a word list or copying a complex figure onto a page includes the protected test stimuli. So those should be protected to protect test security. And both AACN and NAN have position papers to help clarify neuropsychologists' duties when navigating these competing values. But it's important to recognize that jurisdictional laws, copyright laws, as well as publisher-purchaser agreements for these tests also warrant consideration in your ethical decision making. So here's a paper about the most recent guidelines published by AACN regarding test security, and you can look that up and read through it at your leisure. The next common source of ethical conflict is related to third-party observers. So a third-party observer would be to have someone that's not the patient or the clinician sit in and observe the evaluation and testing process. And this occurs in multiple practice contexts, including both for pediatric practice as well as forensic evaluations. So attorneys often request to observe the evaluation to ensure that it was properly conducted, not that they're trained how to conduct a neuropsychological evaluation or to administer any of the tests, as well as to possibly attempt to advise examinees about their responses to interview questions, or sometimes they may be interested in intimidating the neuropsychologist to bias their findings. With pediatric evaluations, either the parents or child may request to attend the evaluation to help manage anxiety or difficult behavior during the evaluation. First off, third-party observers are a threat to test security, and there's lots of evidence that the mere presence of a third party affects test performance. And this can invalidate the evaluation results and can lead to unfair or unhelpful outcomes. In general, guidelines provided by professional organizations indicate that third-party observation should be totally avoided with a few exceptions, those being things like having an interpreter in the room if necessary, or having trainees who are learning to conduct these evaluations themselves, those kinds of situations. The next common source of ethical conflict involves confidentiality. So in contrast to therapy services, the vast majority of neuropsychological evaluations are intended to be shared with others beyond just the examinee. Prior to the evaluation, it's important to clarify both the limits of confidentiality and secure releases of information regarding what information will be shared and to whom the information will be provided, though this can be revisited later if necessary. So the ethical standards regarding maintaining confidentiality indicate that psychologists have a primary obligation and take reasonable precautions to protect confidential information. There's also APA guidelines regarding discussing the limits of confidentiality, where psychologists discuss the relevant limits of confidentiality and foreseeable uses of information generated through their psychological activity, whether that be through therapy or some kind of testing evaluation. Additionally, the discussion of confidentiality should occur at the outset of the relationship and thereafter as new circumstances may warrant in your psychological care for that person. One thing that's important for neuropsychological practice is that sometimes the patient will provide sensitive personal information that's not relevant to the scope of the evaluation or the patient's neuropsychological status, and those kinds of details don't need to be included in the report. So for example, sometimes patients will discuss infidelity with friends and family members that aren't relevant to the reason they came in for the evaluation. Another important concept related to confidentiality is invoking privilege. And this is a right that patients have, and it can relieve neuropsychologists from having to testify in court about information provided by patients. Patients can also waive privilege, which allows the patient to permit treating neuropsychologists to release records or testify in legal proceedings. Competent adult patients can invoke or waive privilege as they choose, although court orders can constrain this privilege. And it's important for neuropsychologists to be aware of jurisdictional requirements regarding privacy, confidentiality, and privilege. The next common source of ethical conflict is related to assessment measures. The APA guidelines when it comes to the basis for assessment. Psychologists base their opinions on information and techniques sufficient to substantiate their findings. So when you're conducting an assessment, it's important to use well-validated measures that can produce the information that's relevant to the question that's being asked and the cause for the referral. So it's important that the methods, tools, and procedures used for evaluations be well evidenced to support the conclusions that are being made and to answer the question that's being asked that's causing the evaluation. Related to assessment measures, obsolete measures or those that lack evidence of utility shouldn't be used during practice. And it's important to note that just because there's a new edition or version of a measure doesn't automatically render a measure obsolete. Additionally, you may need to adapt tests or the testing environment to work around some kind of motor or sensory limitation that the patient presents with. And it's important to describe these adaptations and limitations in the report. And there should be evidence that these adaptations are useful and beneficial for the evaluation being conducted. And when interpreting these assessment results, it's important to take into account personal characteristics of the patient, things like culture, language abilities, demographic factors that could influence the findings. The next common source of ethical conflict is conflicts between ethics and law. Typically, ethical requirements and jurisdictional laws are consistent. However, there are some recurrent instances where they conflict. So for example, copyright law and test security versus the patient's right to test data, which was mentioned before. APA has ethical standards related to this, which highlight that psychologists should make known their commitment to the ethics code and take reasonable steps to resolve the conflict consistent with the general principles and ethics standards of the ethics code. That said, under no circumstances should psychologists use this standard to justify or defend violating someone's rights. And in some instances, adherence to the law may be a more appropriate course of action when there is a conflict between legal and ethical requirements. The next common source of ethical conflict is false or deceptive public statements. Psychologists should not knowingly make public statements that are false, deceptive, or fraudulent concerning either their research, practice, or other work activities, or those of persons or organizations with which they are affiliated. This coincides with General Principle C, which is the one about integrity. And once again, this encourages accuracy, honesty, and truthfulness in our professional activities. Related to this is to avoid puffery with personal credentials. So for example, using terms like board eligible or PhD candidate or other titles that are misleading to the general public. As a professional, if someone says they're board eligible, what that means is they're not board certified, but they're trying to imply that they meet the standards for board certification. The same with PhD candidate means that they don't have their PhD. It's something that they're working towards. But using those terms can cause confusion for the general populace who isn't familiar with the multi-letter acronyms or specific terms that come after someone's name to highlight their professional competence. The motivation to mislead is most common in forensic practice, which typically involves opining about a professional issue in a way that benefits the party that's paying you, despite there being a large evidence-based contrary to the position that you're holding. And this can reflect either an intention to deceive or a lack of competence, and both violate the professional ethical standards. The next common source of ethical conflict is related to objectivity. So there's a variety of threats to our personal objectivity as professionals. These are more obvious in forensic contexts, but can also present in clinical contexts. So for example, fitting data to initial impressions rather than developing impressions based on the data. An ethical neuropsychologist tries to identify threats to objectivity and take them into account when interpreting findings and making a conceptualization for the patient's presentation. So when interpreting findings, psychologists should take into account the purpose of the assessment, as well as test factors, the test-taking abilities of the person, and other characteristics of the person that might be assessed that could affect the psychologist's judgment and reduce the accuracy of their interpretations. The next common source of ethical conflict relates to cooperation with other professionals. And the APA ethical standard is that psychologists cooperate effectively with other professionals to serve the best interests of their clients and patients. And failure to cooperate with other professionals can interfere with professional care, including things like the ability of that patient to acquire appropriate services, resources, or benefits. Part of this cooperation with other professionals includes responding to a release of information in a timely manner and not putting it off, because putting it off can delay care, can slow down administrative decisions or other important matters for that patient. The last common source of ethical conflict involves record keeping and fees. Despite the wide variance in report format, it's important to have appropriate documentation to practice ethically. So the APA has standards regarding documentation of professional and scientific work, as well as maintaining records. So the documentation must provide sufficient information so that someone who reads it can understand the process of the evaluation, relevant evidence to justify the findings, the reasoning and conceptualization underlying the clinical conclusions found in the report, what additional services are available for treatment, and the extent to which reevaluation is necessary. It's also important that reports and other documentation meet billing and legal requirements. When it comes to fees, handling of fees and billing varies greatly by practice. So someone in an independent practice would have total involvement in billing, whereas in an institutional setting, you might have minimal involvement in billing and just provide the billing codes for the services you provide. Regarding fees and financial arrangements, as early as possible in the professional scientific relationship, the psychologist and recipients of psychological services should reach an agreement specifying compensation and billing arrangements. And psychologists should not misrepresent their fees. So no secret add-on fees. And regarding fees, patients and clients should understand, the first being what they'll be getting for their time and money, and the second being that the conclusions will be based on evidence, and that evidence may or may not support the outcome they desire. Which is another way of saying it would be they're paying for the process and not to receive a specific diagnosis or outcome. The final topic we'll discuss is related to an emerging field of neuroethics. Neuroethics is a field that studies the implications of neuroscience for human self-understanding, ethics, as well as policy implementation. For neuropsychological practice, the primary conflict here relates to the adoption and use of new neuroscience technologies in clinical practice. The use of these technologies may occur prior to establishment of their safety and usefulness, which would be unethical. And it may result in a risk of harm without allowing the patient to be fully informed in their decision-making process. The National Institute of Health has a brain initiative with various neuroethical principles, and you can look at those on the right. So I'm just going to highlight a couple of them. So the first is to make safety of the patient paramount. Another important one is to anticipate special issues related to someone's capacity, autonomy, and agency. And then third would be to protect the privacy and confidentiality of neural data. And you can see some of the other guidelines down below. In 2022, O'Shaughnessy et al. Published a paper regarding neuroethics guideline documents. So they went through a variety of different neuroethics guidance documents and picked out some of the common concerns as they relate to ethical practice, implementation, as well as highlighting some of the stakeholder involvement in neuroethical practice. Some of the primary concerns they identified include concerns about safety and privacy, equity and justice, as well as agency, autonomy, and identity. And each of those were broken down into sub-themes as well as key topics. And you can look at this chart to see some of the common ethical dilemmas that come up related to neuroscience and neuroethical practice. So this next chart highlights some of the concerns when it comes to neuroethical governance identified in these guidance documents. So governance of neuroethical policies and practice. The first major theme was public policy. Next relates to neuroscience research practices. The third governance concern relates to implementation within clinical practice. And once again, you can see some of the sub-themes as well as key topics related to these neuroethical dilemmas. And finally, this chart highlights some of the stakeholder roles when it comes to neuroethical practice. A major stakeholder in neuroethical practice are regulatory bodies, whether they be federal or state legislative bodies. Another stakeholder are the clinicians interpreting and implementing the research findings into clinical practice, as well as the industry which is developing a lot of these neuroethical tools, things like Elon Musk's Neuralink, as well as a broader research community engaging in neuroscientific research. So it's important to note that neuroethical guidelines continue to be developed. Most guidelines call for a two-way dialogue to cultivate both public trust and facilitate public involvement in the development of neurotechnologies. They note that it's critical to highlight concrete strategies that stakeholders can actually implement rather than lofty ideals. The paper notes that principles without actionable strategies often fail to be implemented. Additionally, it's indicated that cultural beliefs about agency, autonomy, and identity and the significance of the brain will play a role in the development of various neuroethical perspectives and philosophies, and that this is likely to be an area of tension within the field of neuroethics. If you're interested in learning more about this topic or others, once again, the Clinical Neuropsychology Study Guide and Review Board book by Stuckey et al. Is a great book. Additionally, I want to highlight again the Ethical Decision-Making in Clinical Neuropsychology book by Bush. Additionally, when it comes to neuropsychological practice in general, Schoenberg's and Scott's Little Black Book of Neuropsychology is a great book, as well as the Textbook of Clinical Neuropsychology by Morgan and Ricker. Other useful books include Clinical Neuropsychology, a Pocketbook for Assessment by Parsons and Hammocky, as well as Neuropsychological Assessment by Lazak et al. And once again, additional study resources can be found at brainaacn.org, and you can find written and oral exam study groups, mentorship opportunities, mock exams and sample questions, flashcards, as well as other book recommendations. Thank you for your time. This has been TLDR Neuropsychology. Be sure to like, subscribe, and comment below, and have yourself a great rest of your day.